हाँ जी वैलकम करते हैं तुहाडा सारे स्टूडेंट्स का नर्सिंग करियर चैनल के उत्ते। सो जिन्हें भी हले तक चैनल में सबसक्राइब नहीं किया प्लीज़ चैनल में सबसक्राइब जरूर कर दिया करो ताकि हरेक वीडियो तुहाडे तक पहुँच सके। एंड कम्यूनिटी हैल्थ ऑफिसर का एग्ज़ाम जो कि 7 अगस्त नूं आ काफ़ी नेड़े आ रहा। सो इंपॉर्टेंट क्वेश्चनस दे नाल देखते हैं। फर्स्ट क्वेश्चन आपां अज दा, इन विच ऑफ द फॉलोइंग बोथ एंडोक्राइन एंड एक्सोक्राइन ग्लैंड्स। सो इन्हां विचों किहड़े बोथ एंडोक्राइन एंड एक्सोक्राइन ग्लैंड्स ने? ए पैनक्रियास, बी थायराइड, सी अड्रेनल, डी पिट्यूटरी। सो बोथ एंडोक्राइन एंड एक्सोक्राइन gland is pancreas. Option number A is the right answer. Next, second, a woman serum and urine will test positive for HCG in all of the following condition except pregnancy, ectopic pregnancy, vesicular mole, post hysterectomy. So woman serum and urine will test positive for HCG in all of the following conditions: in a pregnancy, in ectopic pregnancy, in a vesicular mole, but it does not include in post hysterectomy. The test positive for HCG is not in a post hysterectomy. So उन्होंने accept पूछा, so option number D, post hysterectomy is the right answer. Next, third, transmission of maternal antibodies to the unborn child through the placenta is an example of active immunity, passive immunity, humoral immunity, herd immunity. So transmission of maternal antibodies to the unborn child through the placenta is an example of it's a passive natural immunity. So option B is the right answer. Next, question number 4. Menstrual hygiene scheme was implemented for adolescent girls in the age group of 10 to 22 years, 10 to 19 years, 16 to 19 years, 15 to 19 years. So menstrual hygiene scheme was implemented for adolescent girl in the age group of 10 to 19 years. Option B is the right answer. Next, fifth, all of the following infections are transmitted by fecal oral route except. So all of the following infection are transmitted by fecal oral route: hepatitis A, hepatitis B, diarrhea, poliomyelitis. So hepatitis A, diarrhea, poliomyelitis transmitted by fecal oral route, but hepatitis B is not transmitted by fecal oral route. So option B is the right answer. Next, sixth, the most effective drug used to treat caries of diphtheria: azithromycin, erythromycin, doxycycline, tetracycline. So erythromycin is the most effective drug used to treat caries of diphtheria. Option B is the right answer. Next, seventh, which of the following disease condition is a major cause of mitral insufficiency and stenosis? Diarrhea, rheumatic fever, typhoid, malaria. So which of the following disease condition is a major cause of mitral insufficiency and stenosis? It's option B, rheumatic fever. Option B is the right answer. Rheumatic fever is a disease condition, is a major cause of mitral insufficiency and stenosis. Option B. Next, 8. The regular monitoring of blood pressure is under which level of prevention? Primordial, primary, secondary, and tertiary. So regular monitoring of blood pressure is which level of prevention? सो काफ़ी इंपॉर्टेंट क्वेश्चन आ, पिछलियां वीडियो दे विच भी काफ़ी बार रिपीट किया क्वेश्चन। सो इसदा आंसर तुसीं कमेंट सैक्शन दे विच दसना भी की हो सकदा। नैक्सट आपां देख लैंदे आ 9th, The National Adolescent Health Program was launched in the year of 2014, 2008, 2012, 2010. This is very most important question. National Adolescent Health Program was launched in the year of 2014. Option A. Next, 10th. Rashtriya Kishore Swasthya Karyakaram has following 6 priority areas accept: improve nutrition, enable sexual and reproductive health, prevent injury and violence, but accept. So the right answer is address condition for communicable disease. Rashtriya Kishore Swasthya Karyakaram has following 6 priority areas including but accept, address condition for uncommunicable disease. Option C. 11th, the most common side effect of intrauterine device insertion is bleeding, pelvic infections, pain, ectopic pregnancy. So the most common side effect of intrauterine device insertion is bleeding. Option A. Next, 12th, in which year RCH program was launched? 1987, 1991, 1997, 2004. So the right option is in which year RCH program was launched? So it was launched in 1997. Option C is the right answer. Next हैगा 13th. RCH program was launched on 15th October 1997. So what is the main aim to RCH program? Reduce total fertility rate, infant mortality rate and reduce maternal mortality rate. B. Increase total fertility rate, infant mortality rate and maternal mortality rate. C. Reduce child labor, promote child sex detection practitioners and reduce emotional stress on children, increase the fertility rate of women. So RCH program was launched on 15th October 1997. So its main aim is to reduce total fertility rate, infant mortality rate and reduce the maternal mortality rate. So option number A is the right answer. 14th, the fetal movement by the mother is called Braxton Hicks contraction, Goodell sign, quickening, Hager's sign. This is again very important question. The fetal movement by the mother is known as quickening. So fetal movement sound by the mother is called quickening. Option C. 15th, in which year was integrated child development service means ICDS service introduced? In which year introduced? 1965, 1975, 1985, 1995. So integrated child development service introduced in 1975. Option B is the right answer. 16th, perinatal transmission is said to occur when a pathogen is transmitted from non-human to human, infected to uninfected, mother to infant, all of the above. So perinatal transmission is said to occur when a pathogen is transmitted from mother to infant. Option C is the right answer. 17th, severe deficiency of vitamin D result in scurvy, rickets, night blindness, osteomalacia. So severe deficiency of vitamin D result in rickets. Option B is the right answer. 18th, what is the important function of copper T? Stop ovulation, check maturation, stop fertilization, stop zygote formation. So important function of copper T is to stop fertilization. Option C. Next, 19th, Crowning occurs in first stage of labor, second stage of labor, third stage of labor, fourth stage of labor. So crowning occurs in second stage of labor. Option B is the right answer. So last question of today's video. The immunity an individual develop after occurring infection is called. So immunity an individual develop after occurring a infection is called active immunity, passive immunity, herd immunity, all of the above. So the right answer is active immunity. Option A is the right answer. ਸੋ ਇਹ ਕੁਐਸਚਨ ਸੀ ਜਿਹੜੇ ਕਾਫੀ ਹੈਲਪਫੁਲ ਸੀ ਤੁਹਾਡੇ ਲਈ। ਵੀਡੀਓ ਨੂੰ ਐਂਡ ਤੱਕ ਜ਼ਰੂਰ ਦੇਖਿਆ ਕਰੋ ਅਤੇ ਚੈਨਲ ਨੂੰ ਸਬਸਕ੍ਰਾਈਬ ਵੀ ਕਰਿਆ ਕਰੋ। ਅਤੇ ਨੈਕਸਟ ਵੀਡੀਓ ਇੱਕ ਆਪਾਂ ਰਾਤ ਨੂੰ 8 ਕੁ ਵਜੇ ਅਪਲੋਡ ਕਰਾਂਗੇ, ਸੋ ਉਹ ਵੀ ਐਂਡ ਤੱਕ ਜ਼ਰੂਰ ਦੇਖਿਓ। ਸੋ ਓਕੇ ਗਾਇਜ਼, ਟੇਕ ਕੇਅਰ, ਬਾਏ ਬਾਏ।